Hi, my name is Dr. Anuj Shah and I'm the director of Apex Heart and Vascular, and today we're going to talk about diabetes and peripheral arterial disease. So what is diabetes? Everyone knows diabetes is a condition where your sugars run high, but in reality diabetes is a chronic condition which impacts the ability of your body to process the sugars. Diabetes can be divided into type 1 and type 2 diabetes, right? Most type 1 diabetes is when it comes in a younger age, and it typically happens where your pancreas, which creates this hormone called insulin, cannot create enough insulin. Type 2 diabetes is what we see way more common in adults, which is where your body does produce enough insulin, but then there is resistance to insulin. Your body has this resistance which does not allow insulin. So what happens when there is insulin resistance? The job of insulin is to bring blood sugar from the sugar in your bloodstream and provide it to different vital organs. Insulin is this carrier that brings sugar. Because your body is resisting insulin, it does not get the fuel it needs, which is the sugar. So now your vital organs can rely on blood sugar, or glucose, what we call, and it has to rely on fat, which is a bad type of fuel. It's a bad type of chemical. So when the body starts using this bad type of fuel, they secrete something called free fatty acid, which is, if you think about it, because blood sugar, which is the good fuel, your body is creating resistance to insulin, so your vital organs can use the good fuel. So now it starts relying on the bad fuel, which leads to all this toxic substrate. These secretion of this bad fats and chemicals leads to blockage formation process, or the medical term is atherosclerosis, and that's why diabetics are often at very high risk for blockage formations, which can happen in almost all their arteries, including the heart, and that's why diabetics can get coronary artery disease and are high risk of heart attack and getting open heart surgery, stents, etc. Same way, the lower extremity arteries are also very prone to getting blockages, especially the lower leg arteries, because they are relatively small arteries to begin with, below the knee, the tibial arteries. So that's why those get blocked much more commonly, and then that's why diabetics are at very, very, very high risk of developing peripheral arterial disease. We say that if you are diabetic, your risk of developing peripheral arterial disease is 4 times more than non-diabetics. If you are simultaneously with hypertension, high cholesterol, or smoking, your risk goes 20 times higher. If you're somebody who already had a heart attack or stroke, your risk of getting peripheral arterial disease goes very, very high as well. So that's why diabetics and peripheral arterial disease are very common, and they go hand in hand. And that's how PAD is related to diabetes. So how do we treat patients with peripheral arterial disease? The treatment is really controlling the risk factors. So if you're diabetic, control the diabetes, control cholesterol, blood pressure, exercise therapy helps, smoking cessation helps, blood thinning medications like baby aspirin, rivaroxaban, and cilostazol can help. And then there are tremendous options with endovascular techniques where we can go and pass catheters and open blockages. There are certain surgeries that can be done. But the treatment of peripheral arterial disease has really shifted dramatically. A large majority of the peripheral arterial disease now can be fixed with minimally invasive techniques, which used to be very difficult back in the day. So if you are diabetic, you're already at risk of peripheral arterial disease. You don't even without any symptoms, you should get screening. Screening for peripheral arterial disease is very simple. Make sure you get your feet examined in your doctor's office. Make sure your pulses are checked. And oftentimes there is a test called ABI, which is checking the blood pressure of the legs. It takes less than 15 minutes. It's a completely non-invasive test, and insurance pays for it. The test should be done on almost every diabetic patient if you're above 50 years of age. If you have any symptoms like pain in the leg, cramps, if you happen to have any open sores or wounds or ulcers which are not healing, 100% get checked for peripheral arterial disease, because that truly could be the reason that you have peripheral arterial disease and poor circulation, which can eventually lead to amputation. So we always talk about heart attack. There is a lot of awareness about heart attack, but people don't think about foot attack. There is less awareness about foot attack, but diabetics can get a foot attack. Pain cramps, achiness, discoloration, non-healing wounds, all these things could be a serious circulation problem which can lead to amputation. So get tested, get checked, and get it fixed. Finally, I want to part with the one last point, which is the racial disparity. Okay, within peripheral arterial disease 1 and diabetics, if you are a person of color, which means African American population and Hispanic population, both these populations, and actually Asian Indian populations, all these three population groups are at much higher risk of getting diabetes compared to the Caucasian counterpart. But even if you have if you are diabetic and if you are a person of color, your risk of amputation goes significantly higher. Especially in African American, the risk of amputation is almost quadrupled in certain studies compared to rest of the general population. So racial disparities play a big role. If you are a diabetic with color, whether it's a Hispanic, African American, your risk of future peripheral arterial disease is much higher. Please get tested. Work on the risk factors, exercise regularly, and make sure that you control risk factors like smoking. So any further question, please feel free to reach out. Email us on shahpractice@gmail.com. Our website is apexheartandvascular.com, or please give us a call on 973-916-0002. I would love to hear back from you and answer any other questions. Once again, September is Peripheral Arterial Disease Awareness Month. If you are diabetic, you have a risk, please seek attention.